I'm just coming on here to talk about the last post that I did. I talked a lot about POTS, histamine intolerance, MCAS, all of these things that are trending, that are acting like they're root causes for your symptoms, but they're just explaining your symptom patterns. Now, I want to talk about some of the drivers that are turning on these symptoms that are sometimes hidden in our body as self-infections, so they're hard to understand. One easy way to explain it is if you understand shingles, right? You know, you had chickenpox, the virus stayed latent in your body, it was never fully cleared, and when your immune system is challenged, you can have an outbreak of these painful blisters that create nerve pain and nausea and all of these other symptoms. Well, there are a lot of other poorly understood similar bugs that aren't viruses that can do this as well. One of them is Babesia, and this is why I listed it here. And here's some of the common symptoms. They can be depression, anxiety, heart symptoms, so not really POTS, but maybe some Babesia got turned on. You might have these symptoms of drenching night sweats, but not have all the other symptoms. You might feel that sense of impending doom when your mast cells are activated, but they're being activated by the Babesia infection. But the thing is, these infections, they don't exist on their own. There's usually other infections along with them complicating our immune system. And our immune system then turns on the complement immune system, and we get a big amount of inflammation, and that creates these symptoms, and it can lead to autoimmunity, and it's very complex and hard to understand. I had to go through all of these infections on my own to really grasp it, so I understand that it's really hard to grasp. But Babesia is one infection that it's a parasite, and it goes into your red blood cell. It's really hard to diagnose. It can go latent, but once your immune system is dysregulated from maybe a viral infection, trauma, we're all exposed to a lot these days, then all of these stealth hidden infections that were in your body, think of it like the shingles virus, then they start to create symptom patterns because they start to replicate, and you can actually test for them and see more in depth which infections these are. So I personally did the tick-borne 2.0, which really I think should be called the stealth infection panel, because it looks at all of these infections that are opportunistic. It does look at Lyme, but once you start to dive deeper into this world, you start to know that you're not just getting Babesia or even Lyme from just a tick, even though that's what it says online. It can be passed in multiple ways. Any vector that stings or bites, if it bit someone and got some of their red blood cells, then you could, in fact, be exposed. So let's just keep in mind that there can be multiple stealth infections that all have their own pattern of different or overlapping symptoms that can be mistakenly called mast cell activation. Now, all the things that help you with mast cells, that calm down that storm of immune dysregulation, can help you make space to actually treat these infections. Because if you're not supporting mast cells while doing this, you can send people into worse symptom patterns of flare and even more danger. So I just want people to keep in mind that mast cell activation is a great diagnosis of pattern of symptoms, but you have to find what's driving the mast cells. Babesia is one of them, but there are multiple. And I think that everyone should be investigating their stealth pathogens when they're having these symptom patterns.